Welcome back, YCN Sports Talk. Jeremy Stout, Dustin Ribellini, and before we get into our next segment, the Valley Regional Healthcare Prescription Playbook, let's go to our games that will be on Friday night, 8:30 p.m. live college hockey, Cornell at Union, and then on Saturday, college basketball starting at 2 and going all the way. The last tip-off is at 10 p.m. And then the YCN Game of the Week is next Wednesday at 8 p.m. That's the Hopkinton boys at Kearsarge boys. An exciting game next Wednesday at 8 p.m. Now we have our prescription playbook brought to you by the experts at Valley Regional Healthcare. And this week we talked to Dr. Hawkins about Martellus Bennett, and we'll set this one up. Obviously, we've talked about the injury all along. It's not a big enough injury to keep him out, but it'll be interesting to see what Dr. Hawkins has to say and how much it could affect his play.
Yeah, you've seen Martellus Bennett over the season have some good games, but also have some games where he really looked hobbled by the injury. And I think it's bothering him a little bit more now, of course, with a week off to rest before the Super Bowl. Hopefully he's a little more healthy. But you could see this, anytime you get a foot ankle injury, it always slows you down a little bit. So it's going to be interesting to see what Dr. Hawkins has to say. All
right, let's take a look right now.
With regards to Martellus Bennett's injury, initially was described as an ankle sprain. So, without knowing the details of the X-ray findings or the specifics of the injury, the suspicion would be that many times when you sprain the ligaments of the ankle, as the ligaments pull, they may take a small piece of bone off, which is otherwise called an avulsion fracture. And the significance of that would be not only does it suggest an injury to the bone, but also the ligament. So there may be some mild instability of the ankle. He's playing a very high demand position. He's blocking, cutting, turning, pushing off. And all these things are putting stress on those ligaments, which is pulling on that little piece of bone that doesn't allow it to heal. So many times those small fractures don't heal, and they can become asymptomatic or not continuing to cause pain, but sometimes they do require surgical removal. Well, initially the injuries are quite painful, mostly because of the inflammation that occurs from the traumatic response. So the blood flow increases, the body has all the growth factors and everything rushing to the site to try to heal the injury, and that initial response is very painful. We use the principles of RICE, rest, ice, compression, elevation initially after an injury, particularly in the first 24 hours, to decrease that painful response. But we don't want to continue to dampen that response because those growth factors are helpful in the healing response. Yeah, so I think that the circumstances between a professional athlete, particularly at this time of the year, everything's on the line. It's a Super Bowl. You have 6 months to get better. This is your career, this is your life, this is your job. And his full-time job is to recover from this injury, and he has all of these specialists at his disposal to help him do so. For the weekend athlete, or particularly the young athlete, the approach is going to be much more conservative. Playing through pain is probably not a great idea in most cases. And if we can take a short amount of time away and allow rest and recovery, then we can prevent more prolonged time missed down the road. Well, I think the fact that he's been able to play through it would suggest to me that he does not have a severe amount of instability in the ankle. So they're able to support that through taping and other means, so that he's able to provide the force he needs to push off and do those activities. I think in this case it sounds more a bit of a pain tolerance issue, as he does more and it becomes more painful, then he may not be able to continue to do that.
Thanks to Dr. Hawkins there, talking a little bit about Martellus Bennett, and obviously the injury is not really, it's one of those things where they can tell you a little bit about it, but as he stated, you don't know exactly what it is. It's not like the Gronk where we knew.
And that's the hard part whenever a guy gets hurt is, especially in football, you see there's so many injuries that could pop up, leg or ankle, wrist, foot, whatever it may be. Like we'll talk about Julio in the last segment here. Sometimes it may seem like a foot injury, but it could be something else. It's a totally different ailment. So for Martellus Bennett, it's again just trying to play through that pain. It's not hindering him full on the field, like you said. He's not going to miss the game,
right?
But you just wonder how effective is he going to be.
And it's the last game of the year. They have all the time to recover, so that's a big factor. Do you think, just from an offensive standpoint, do you think he will be a big factor in this game? If you're Bill Belichick, are you going to try and maybe get him involved because the Falcons might be taking him lightly, or is it one of those things where you just want him to block and the Patriots have enough weapons?
I think you're probably going to see him more in a blocking standpoint, just because, like you said earlier, the Falcons' rush is speed off the outside. So you're going to keep the tight end in a little bit more, especially on the pass plays down the field, to make sure Brady has enough time to get the ball off.
And it's going to be interesting. This Patriots offense, we've talked about it all year. They rely around their tight ends. They've always had two good tight ends. This year, not so much. Now they basically are down to their last half a tight end, really, with the way Bennett's been playing. But give him credit, he's staying out there.
Right.
And another guy who's been staying out there hurt for a lot of the season is Julio Jones. And we'll talk about him when we come back. You're watching YCN Sports Talk.